Hi, my name is Lizzie Corkin, and I'll be talking about my service at Crisis Nursery this semester. Crisis Nursery is a temporary home for children who are at risk of abuse, neglect, or emergency situations in their family life. They come and stay at Crisis Nursery for a few days to get tests in terms of cognitive development as well as basic health determinants. Also, to help relieve their families of mental stress, and especially if they're experiencing lack of resources, to help them get back on their feet in that form. The ages of children that stay with us are usually newborns through 12-year-olds, and they're divided into two sections, young kids and old kids, and I've worked with both. I've been working at Crisis Nursery for 2 years, so I've learned a lot, but there are definitely things I still learned this semester, especially connecting it with my public health classes. Some things I don't like about working at Crisis Nursery is that it's very hard to develop continuity in relationships with the children. Since they only come for a few days, I have met many children, but only met them once, and it's very hard to, and basically impossible, to develop long-term relationships with the children. And the staff, that is also a problem. It's hard for the staff to develop trust in you unless you go every single day at the exact same time. In that way, there's little room for upward mobility. And it's hard, and because of the privacy that the families require that use Crisis Nursery, you don't really get to interact with the parents or interact with that side of the population. But some great things about Crisis Nursery is with working with children, it's very obvious by the way they behave, talk, and act what their home life is like. So that's very easy to kind of think about what their daily life must be like, considering how they acted at Crisis Nursery. They have very little embarrassment and very little inhibitions about talking about their home life, so you really could learn a lot very quickly just from spending a few hours with them. And the number one thing I would say I learned is that although I didn't always get a lot out of it because I wasn't able to gain more responsibility, I absolutely learned that my time and my attention is extremely valuable and really does make a difference to these kids, even though I couldn't help them in the long term and I couldn't develop a relationship with them. So some of my basic activities, the majority was always playing with the children, but I also did a lot of household chores. I changed a lot of diapers, I gave some baths, but we also take a lot of donations, sort those donations, and parcel them out to the families that come. I also did a lot of cooking, cleaning, washing laundry, mopping floors, and a lot of other basic chores. So that was what serving at Crisis Nursery was like every day. And so it's kind of easy to see how it's very difficult to rise beyond that service level and gain a deeper understanding of the population if that's the things I do every day. So the population that uses Crisis Nursery is almost always African American. They almost always are of a very low socioeconomic status and have low education. But the two global health concepts that I noticed the most were poor maternal and child health, as well as mental health. Poor maternal and child health, I saw the parents and the children are both either very malnourished or very overnourished in a negative way. And that probably relates to poor access and poor education about healthy choices and how to best feed growing bodies, especially if you have multiple children, how best to feed them and how to teach them about food. Mental health mental health problems came from the instability of home life. They often stayed with their parents or relatives, and they stayed at Crisis Nursery, so there's very much a lack of stability in home life, and that was seen in mental health effects such as poor cognitive development, behavioral problems, and a kind of retarded growth or retarded development of education and basic educational knowledge. And that was also extremely evident in the children, as well as sometimes in the parents. You could see they're extremely stressed out, extremely not confident in their ability to take care of the children, and that was sometimes seen as neglect or abuse, and that was the negative mental health effect that they experienced. So overall, I learned a lot at Crisis Nursery and was able to connect some global health concepts such as poor nutrition and mental health to the population that I served. Thanks.